Hello, let's discuss normal vitamin D metabolism. Vitamin D synthesis begins in the skin when the UV rays convert the 7-dehydrocholesterol into vitamin D3, which is also called cholecalciferol. Okay, after that, this is the first step which occurs in the skin. Then the second step occurs in the liver, in this step the cholecalciferol gets converted into 25 hydroxy vitamin D by the enzyme called 25 hydroxylase, which is present in the liver. Then the final step in the vitamin D synthesis is this step, which occurs in kidney with the help of this enzyme 1 alpha hydroxylase. This converts the 25 hydroxy vitamin D into 125 hydroxy vitamin D, and this is the active form of vitamin D. Okay, 125 hydroxy vitamin D, and it has a effect on bones. In bones, it causes mineralization and remodeling of the bone. It has effect on small intestine, and this effect of the vitamin D is the major effect. And on the small intestine, in the small intestine, it causes the increase in calcium absorption. Okay, while in the kidney, it causes the calcium and phosphate reabsorption. On the parathyroid gland, it causes the suppression of the parathyroid hormone secretion. Okay, so this is the normal vitamin D metabolism. And one thing that I would like to mention is this 1 alpha hydroxylase. Parathyroid hormone stimulate this, while the fibroblast growth factor 23 suppresses it. Okay, so now one thing that I would like to discuss is that what happens in chronic kidney diseases. In the chronic kidney disease, there is impaired conversion of 25 hydroxy vitamin D to 125 hydroxy vitamin D. So in the chronic kidney disease, this step is impaired. Okay, this steps in the which occurs in the kidney is impaired due to chronic kidney disease. So the impaired conversion of 25 hydroxy vitamin D to 125 dihydroxy vitamin D is due to three factors. It is the first factor is the increased level of fibroblast growth factor 23, which occurs in the CKD. And when the fibroblast growth factor 23 increases, it causes the inhibition or suppression of 1 alpha hydroxylase, which stops or prevents the conversion of this 25 hydroxy vitamin D to 125 hydroxy vitamin D. The second factor in this is reduced glomerular filtration. Reduced glomerular filtration causes the reduced filtration or reduced circulation of the 25 hydroxy vitamin D to tabular cells of the kidneys. So when there is reduced 25 hydroxy vitamin D in the tabular cells, then it can be converted, or there is less conversion of this step. Okay, so reduced glomerular filtration is one of the factor which can impair this conversion. Now the third factor is reduced functional renal mass. So when there is reduced function of the kidney, there is decreased production of 1 alpha hydroxylase enzyme. Okay, so this is the third factor. As a result of all these factors, there is reduced production of this active form of the vitamin D, 125 dihydroxy vitamin D. So there is less bone mineralization, there is less calcium. As a result, hypocalcemia occur. Hypocalcemia reduce calcium level. Okay, when there is reduced calcium level, then it will cause the increase PTH level. Okay, so when there is increased PTH and there is less calcium and phosphate reabsorption, so as a result the PTH get increased, and this is called secondary hypoparathyroidism. Okay, as a result of hypocalcemia, which is due to the reduced active form of the vitamin D, there is decreased calcium, decreased bone mineralization, decreased calcium reabsorption, and as a result of it there is increase in level of the parathyroid hormone, which is called secondary hyperparathyroidism, not hypoparathyroidism, it is hyperparathyroidism. So as a result of it, the bone, there is the muscle pain, bone pain. Okay, so this is about the vitamin D metabolism.